As Ben mentioned, this session I'm going to talk about health insurance and how it relates to health services at Grinnell College. Again, I'm Alexis Steele, she, her, and I'm the manager of operations at Student Health and Wellness, or as we like to call it, SHAW. As Ben mentioned, you can put questions in the chat since you're all on mute. Thank you for that. But let's dive right in. So health insurance. Oh, it's so confusing. So this presentation is going to be about health insurance only. We're not going to be talking about vision insurance or dental insurance. It is important to know that these are separate and are not included with the student health insurance plan. You can purchase these, but again, they're not included and they're not required. So jumping right into health insurance. So Grinnell College does require students to have health insurance. So why? Why does Grinnell College require this? Well, we want to ensure that students feel safe and secure and comfortable seeking health care. We've seen students refuse life-saving care due to costs, and having comprehensive health care helps reduce this barrier. So Shaw is a basic health center. Um, this means that we have to refer students off campus for higher levels of care, things like x-rays, physical therapy, things like that. Ooh, wrong button. So Shaw actually doesn't have a lot to do with the nitty-gritty of the student health insurance. So this slide is going to kind of talk about who does what at Grinnell College. So the Office of Finance actually reviews and decides on the provider and the plan. And this United Healthcare has been our provider for a couple years, and they have the most cost-effective option. The Office of Student Accounts manages the billing of students and waiver support. So Gallagher is the company that actually reviews and handles the majority of waivers. Student Accounts just kind of helps with that process. So if you have a bill and you don't think if you have something on that says health insurance on your bill and you don't think there should be that, that would be Student Accounts. And then us, Shaw, we're more support for students. Any questions or concerns about claims, explaining to students if you're referred off campus, what will or won't be billed to your health insurance, how it's utilized, how to read the explanation of benefits, things like that. So it's confusing. You can always start with Shaw and we can refer you to the correct people. If you're like, I have a question about health insurance, but I don't remember what office, you can always start with us. We got you. All right. So the student health insurance waiver process starts June 20th and ends August 14th. The students have to waiver enroll every year you attend Grinnell. Policies are for 1 year, and to waive, you have to have an existing health insurance plan that is US based. That means that international plans aren't accepted. It complies with the Affordable Care Act, and it provides in-network benefits in Iowa. Out-of-state Medicaid options or out-of-state Medicare policies are not accepted. If you have Kaiser, I'm just going to say it, you're going to want to enroll. But student accounts does work with financial aid. So if a student is on out-of-state Medicaid, they will automatically receive a grant to cover the cost of the student health insurance, and others can apply for a grant through financial aid to help support the cost of health insurance. Information is on our website, which is www.grinnell.com/Shaw. And I'll show you a visual of how you can get to the health insurance page from our website in a second. But before you consider waiving, be sure to take virtual services into account. So Shaw's open Monday through Friday, 8 to 5. And we have an ER and walk-in clinics that are open after hours. It's sometimes easier for students to have a virtual option. The majority of health insurance plans offer this. So we recommend finding out if you do waive what your virtual option is or reviewing it with your student. Students who do enroll in the student health insurance will have access to Healthiest You. We are looking at counseling options for students who are referred off campus, but I don't have that contract yet, so keep an eye on your email and information will be sent out about that later. Now I'm going to walk you through the website. So when you go to grinnell.edu/Shaw, this is where you are. So if you look at that left navigation where that big old arrow is, you see health insurance. And then when you click on the health insurance, you have the dental and vision plan options and the FAQs. But this, if you scroll down, the majority of information is there. So that's how you can get to more information about health insurance. Look, I did fun things and I forgot. Okay. So if a student does nothing, they will automatically be enrolled and thus billed for the student health insurance. However, it's important to note that there will be a delay in being covered. That's not to say you won't be covered. Coverage starts August 14th, but if you see a provider, coverage starts August 14th, and if you do nothing, the insurance number won't be available until mid-September. So if you see a provider after August 14th and before that number is processed by the health insurance company, the provider will bill the health insurance company and then be like, they don't have an account, they don't exist. So then you have to talk to us and we can put a rush on it. So we really encourage students to enroll so there isn't that weird gap and so that they don't have to deal with that. Just know that you are covered. We can help navigate if that happens, but you can avoid that by actively enrolling.
Yeah, I just want to
Oh,
emphasize that
yeah,
really quickly. It's only if you do nothing to
correct.
actively waive or enroll that you would have a delay in not coverage, but delay in processing. And so we
Yep.
don't want you to have that stress. And so if you're going to need the student health insurance, go ahead and enroll so you have it right from the moment you step onto campus, ready to go. Or if you can waive, then you know what your health insurance information is. Make sure that you have your card active and with you. That may be not something you've had to manage in the past. You want to make sure you have your appropriate documentation on your person at all times.
Yes. I should put a note about that. Okay. So coverage starts August 14th and ends August 13th. Um, you pay for a year. It is national coverage. That means it's accepted anywhere in the United States. You can search for providers on the insurance website. It does have global coverage, but be aware that care outside of the United States, you'll have to pay up front and then submit the receipts for reimbursement. Um, so coverage is for a year. There are exceptions. Some students that are abroad or on leave can be made, but that's specific to student situations. So you would need to contact student accounts to discuss your specific situation to see if you could get a semester exception. And waiving and enrolling happens through Gallagher. It doesn't happen through Shaw or Grinnell College. It's actually through Gallagher. So Gallagher is the broker. They provide the college with options because health insurance companies won't talk to us directly. So you go to Gallagher and they have all the information. There is a copy of the plan. I don't think this upcoming year's plan is up there yet, but there are no major changes. So you can look at last year's and it will have the copay, the deductible, those will all be the same. United Healthcare Student Resources is the actual insurance company for the student health insurance plan. And yes, the student resources part is important. United Healthcare is different than United Healthcare Student Resources. So that is important to know. So basically, questions about the waiver process and coverage start with Gallagher. So you can, there's a phone number or go.gallagherstudent.com. If you have questions about a claim or this should be covered and it's not, or why it wasn't this covered, excuse me, then that goes to United Healthcare Student Resources or uhcsr.com. And it's important to note, so we have the first time logging in, you'll need to create an account. And some people get confused because you have to have an account on Gallagher, and that doesn't roll over to United Healthcare. So each one has their own specific login that you'll need to create. Now let's talk about specifics of how the services that Shaw offers relates to health insurance. The majority of services at Shaw are free. Um, this includes CLIA waived labs. Don't worry if you don't know what that means. It just means basic tests, like strep throat, strep tests, UTIs, pregnancy, mono, flu, COVID, kind of the general common ones. We provide basic medical support for wound care, STI testing, allergies, rashes, ear pain, bug bites, a whole list of other things. We also have staff counselors who provide short-term individual therapy, a variety of group therapy options. They help with crisis management, post-hospitalization care, consulting, and referrals. So when a student is referred to an off-campus provider, things like, is this provider in network with their health insurance? And would this provider be a good fit for the students? Are all taken into account. We also have a partnership with the University of Iowa and are able to provide telepsychiatry for free for students. So psychiatry is medication management for mental health diagnoses. And the cool thing about this is the students actually come into our office and meet with a nurse in person to get their vitals taken, and then meet virtually with a provider in an office that we provide. So that's easier for transition of care and ensures that the student is actually seen. All right. So most of SHA services are not billed to insurance, but there are a few exceptions that are important to note. So we contract with an off-campus provider with an off-campus counselor to come onto campus a few days a week. This counselor does bill to insurance. Students will meet with a non-insurance billed counselor first and told about the billing before they start with that provider. Some lab works are sent off-site for processing. So these include pap smears, vaginitis screens, and a few other less common. These are mostly run through our PA, who is really great about explaining this to students. I'm pretty sure every year she like gets a list from the hospital about rough estimates of costs, depending on coverage. Students can have prescriptions delivered to Shaw, which is kind of cool, from 2 of the 3 pharmacies in town. However, we don't fill the prescriptions. So the pharmacy would bill the insurance and then they can send it to Shaw. So if our PA or telepsychiatrist orders a prescription, that would be processed through insurance through the pharmacy. So the important thing is that the first appointment with a Shaw provider is not billed to insurance. Any services that are billed will be explained to the student before they are rendered, so nothing is a surprise, and allows the student to be confident that you can always start with Shaw in a non-billing fashion. All right. So some local providers, so providers outside of Shaw. The ERs, I actually Googled it. It's 1 mile. It's about almost exactly a mile away from campus. We have 2 walk-in clinics in town that are open after hours. They do bill as doctor's office and not urgent cares. I had a question about Kaiser. This usually is where we have a problem. Kaiser covers urgent cares. They'll cover urgent care and ER visits, but they don't cover doctor's office visits. We don't have an urgent care in town. We have walk-in clinics, which are billed as doctor's office visits. So that would mean you wouldn't have coverage in town. Uh, we offer free in-town transportation to medical appointments. So if you don't have a car, or you have a car but you don't feel good, so you don't want to drive yourself, Shaw can drive you in town to medical appointments. The local hospital does have visiting specialists, but there are a number of students who require specialized care that travel to Des Moines or Iowa City. Each of these larger cities are about an hour away. This isn't ideal for most student schedules because it can take half a day, right? An hour there, an hour back, and then, depending on how long you have to wait for your provider. And a lot of students don't want to miss class, which is great. Good for them. So if a student doesn't have a car and has an out-of-town appointment, they can arrange a driver to take them through our facilities management department. Requests need to be made at least 24 hours in advance, and the fee's about $150, depending on how long the driver waits. And I would be remiss if I didn't mention the health requirements for new students. So these are due July 15th. I'm not going to lie, we picked a date because everybody works better with a deadline, but there is wiggle room. So if you're a student and most people can only get a physical once a year, if the date is after July 15th when you can get your physical, that's okay. Um, the the goal is to get everything done before you arrive on campus. So any student who arrives on campus and hasn't completed the requirements will need to meet with a SHOP provider. Domestic students, you should have access to all of these vaccinations. Um, and so we really encourage you to get it. Be aware that there are some 2-dose series and one is like 6 months apart. So you might not be able to get them all, but get as many as you can. International students, you might find that certain vaccines aren't available in your country. Don't worry. We are aware of that. It's nothing to panic about. You'll meet with a SHA provider and we'll help you get it scheduled and obtain it. So when you meet with the SHOP provider, this is for the majority of students, it's on move-in day. For early arrivals like PC Pop or IPOP, if you don't know those acronyms, it doesn't apply to you, don't worry. We have some scheduled time set aside for you to come and meet with people. Um, so the goal is to get everything done, but if you don't get everything done, we're here to help and support you. So when you meet with that provider, if you don't get everything done, the provider will go over what's missing, when it's due, and then help get you scheduled for a time to obtain this. And yes, Ben, fees, going back to the transportation in Iowa City or Des Moines, it's billed to your account. So you don't have to pay up front. You don't have to like show up to the card with a debit card or a wad of cash. It's billed to your account. Alrighty. So, I got distracted by questions. All right. So waivers and specifics are available on the new student website. Items have to be entered into the health portal. Information about that is on the new student website, the new student checklist. If you have specific questions, you can go through the portal. That's the fastest. Um, so when you enter things into the portal, you'll have to upload documentation of all of your vaccines, and then you have to manually enter the dates. So when you enter the date, the system reviews the dates and is like, yes, that meets what it does. But then our nurses will go in and review the dates because mistakes happen, to make sure that they match up. And then all the forms that are uploaded have to be manually reviewed and approved. So this means you might upload something and it's not marked compliant and you're like, but I did it. It just takes a couple days, a couple business days to be reviewed. Our nurses are pretty quick about it. So it usually does only take a couple days, sometimes same day. If the nurse has a question or notices something's incorrect or you still have things due, they will send a message through the portal. Don't worry, you don't have to obsessively check your portal, just your Grinnell email. So if a provider messages through the portal, you'll get an email that says, hey, you got a message in the portal. So that's when you know you need to check your portal for that message. And the reason they message through the portal is so we have access to that, so that all the nurses and providers can see who's communicated with who so that we don't over communicate with you all about that. All right. So if you have specifics about your health or your student's health, you can always call us 641-269-3230. You can email us at shaw@grinnell.edu. And we'll get you connected to someone who can advise you, the best person to talk to about things. You can also go to our website, again, grinnell.edu/shaw, and kind of see about all the services we offer, what's available, things like that. Here is a big ugly page of contact information for the various people who can help you with insurance questions. Remember, you can always start with Shaw and we can get you connected to the right person. You can start with me. deal@grinnell.edu. And then finance, if you have claims problems or want to let them know about claims problems, I try to keep finance aware so they know when they have the selection for the next year, how it's going. Student accounts, so if you have questions about charges or waivers, you can go to student accounts. Gallagher, if you're having trouble entering your waiver stuff, you can go there. And then United Healthcare Student Resources is claims. And now we have questions. This recording, the video and the PowerPoint will be available later on. And I see I have a question specific. And Eric, I will look into that and reach out to you specifically about that. But does anyone have any general questions about the insurance? Okay, so June 20th, the process to enroll or waive open. So on June 20th, you'll be able to go into Gallagher and waive or enroll in an account. If you don't have um, health insurance, then you'll have to enroll. And I hope that answers the question.
If it's a case of where they issue cards for the primary account holders, then we can see if we can get a documentation of coverage just so that it's clear that there's coverage that covers that. And again, it's really important to check. You may have the best coverage in the state you're in, to make sure that it provides the coverage in the state of Iowa. We've had some students who again have run up against unexpected expenses because their insurance, while excellent, does not provide the coverage and access that they need in the state of Iowa. And again, we don't want students to delay care simply because they're worried about the cost or something being out of network.
Yep. I do have a question about a student athlete. Student athletes, so any injury during a game or an athletic event actually is not covered by the student health insurance. And that is why student athletes are required to get an additional insurance plan that covers them during games and their participation in sports. So you should be getting that information from athletics. Again, I don't know the specifics of that. I'm not privy to it. I know it exists and that you have to enroll in it. And that covers you during games and such.
So there's a
Yes,
question about whether if you are still on your parents' insurance, can Shaw assist you in finding a doctor locally?
100%. Um, so again, Shaw's free, so you come to Shaw, awesome. That's great. Um, sorry, I got distracted. I read the second question. I shouldn't have done that. So we'll still help you find that doctor. There's a lot of different places where you add your insurance card. So when you waive, you can add your insurance card on the portal. When you enter your immunizations, you can also upload your insurance information. And then if we refer you to an off-campus provider, if we have that information, we'll fax it to them because the goal is to carry your health insurance card everywhere, but not every student does that, especially if they don't feel good. So we really encourage students to upload those health insurance cards to the portal as well as Gallagher. And yes, no matter what your insurance is, we look at that. We see what insurance you have and see who's covered and how we can help you. Before we had a PA, so we didn't have anyone who could prescribe. We had students whose insurance would only cover ERs, and we had to send them to the ER for pink eye. They just needed a prescription, but that's the option they had. So the policies in place are to help not have that. And luckily, we have a PA who can help prescribe. Athletes can use their parents' insurance, but again, I believe you'll have to speak with athletics. I'm not sure, but I'm pretty sure that you have to have it's an NCAA requirement to have that.
I got a direct question, Alexis, about where should they order their immunization records from? Should they get it from their prior school district who had those records? Should they go directly to their doctor? Um,
Yes, and all of the above, wherever you can get them. Some states will have a record. So I usually start with the doctor's office. They usually have good records. You could also go to your school. It's whichever you're more comfortable contacting. One might have it, one might not. So yeah, uh, doctor's office and school districts are both good places. Your local public health also is another place you can check to obtain records and or vaccinations. Um, I know Iowa has a system where every place enters the immunizations, and so the state of Iowa keeps track of that no matter who your provider is, which is kind of great if you switch providers. So different states have this, different other states don't. So you could check with your state, and that way, if you've switched providers, they might still have that information. Any other questions?
I think something I want to emphasize is that you can get a great deal of your care handled with Shaw. Um, and so I think it's always a great place to start. You can just walk in, you can set up an appointment in advance. That can be really helpful, especially if you're feeling, crappy the night before and you just want to get on the calendar, especially if you're trying to still navigate assignments, projects, and meetings, and you're not feeling unwell enough that you can't go to class. And so you can work it in and know that you can be seen relatively quickly. And our nursing staff are excellent and are more than happy to help. And again, they will make referrals as they need to.
Yep.
But I think the vast majority of our students can get much of what they're handling and what's going around campus. They're very clued into the things that we're navigating and managing within the campus environment. And they're ready to respond. And then again, if they need to make a referral, they'll help facilitate that and get you connected, and so that you can do as much as you can locally as well.
Yeah. I had something to say and I forgot. Wow, I am forgetful this morning, y'all. I apologize for that. And they're really good about helping you transition, right? We're all used to parents and you're kind of transitioning into adulthood, and our nurses are really good about bridging that gap and helping you make that call, empowering you to do certain things on your own if you're ready for that, and just kind of helping bridge that gap of I don't have a mom, what do I do? Which is how I felt when I was in college. So yeah, wherever you're at, they'll meet you. So
The one thing I do want to add is that we have had students come and say, I've got this huge bill. What does that mean? And that the nursing staff or Alexis has helped them kind of understand, like, this is what this means. It's still being billed to insurance, or they've been able to say, like, okay, this clearly got coded wrong.
mhm.
Let's help make an appeal directly to the insurance company or to the doctor's offices. And so, no, again, we can help demystify that as you navigate your health care on your own in a way that maybe you haven't had to before. It can be a scary thing to jump off into. We did get some questions about where do students go to get the shuttle to a doctor's office. I'll speak. Alexis, I'm gonna let you handle that first, and then I'll speak about our after-hour shuttle.
Yeah. So the Shaw shuttle, you take a ride in Vanna White, which is the name of our van, and we actually have student drivers, but you come into the Shaw office and you check in, and then we have a driver drive you to the provider's office, and then you call us and we send the driver back to pick you up. So that's how it works. And if you don't have a phone, some international students don't have a working phone, the offices are really good about calling us and being like, "Hey, your student needs a ride." So they're all very friendly and help with that. So yeah, it all kind of works out of the Shaw office for the Shaw shuttle. And again, that Shaw shuttle is only for medical appointments and like prescriptions.
And then in the evening, we do have a regular local shuttle from like 4 to 7, or maybe even later. I think I may have be misreporting that. And it goes around town. It can take you, it's one of the stops is the walk-in clinic. And so if you need to do that, and then of course, after hours, if there's an emergency and you need to get to the emergency room, our campus safety office is happy to provide a ride to the local ER. So when we say it's just a mile away, it doesn't mean you get to walk a mile. It means you have mechanisms by which you get there. But it is really nice to have it so close, which is why our campus safety office can provide that transportation after hours. They will both take a student there, and then the local ER will give us a call, and let us know that you need to be picked up. And so hopefully we can avoid the emergency room as much as possible. But at the same time, if you need that, know that there are both scheduled and emergent levels of transportation available for our students.
Any other questions?
So if you do think about questions after the fact, I would recommend starting with Alexis or the General Shaw email account. And then if you have individual questions, that student portal is really good so that we can keep it protected and private. Our nursing staff doesn't want to communicate with you over email. They want to communicate through the portal because it's secure. We can ensure that only you are viewing that. Yeah.
All right, I'm chatting with someone, and I gave you my email address so we can continue this offline because our chat's gonna go away as soon as we end this meeting. So, but yeah, if you have any other questions, here, I'll actually put my email in the main chat. Um, and you can always reach out and at any time. I also help students after the fact. Recent grads often are like, ah! And I'm like, I got you, it's okay. So yeah, we are here to support and help you.
Good luck this summer. We're excited to see you in the fall. And thanks, Alexis, for providing such critical and important information, demystifying the insurance experience, and providing an overview of all of our health services. We're so excited for you to start this journey with us. And just know you have two friendly faces that you now can connect with if you have any questions along the way. Thanks.
Great. Have a great rest of your summer. See you soon.